Hello everyone, my name is Mark Nosen, and today I'm going to be talking about and narrating the muscular disease that my group chose, which is multiple sclerosis, also known as MS. And so today I'm going to be giving the summary of it, and then my group mates are going to go into the other technical aspects of this muscular disease. So basically, for what I want to start off talking about is the discovery of MS, sclerosis. Basically, it was discovered in 1868 by Jean-Martin Charcot, who is a French scientist and a researcher. Basically, he was able to distinguish between multiple sclerosis and Parkinson's at the time, because prior to that, there was really no understanding the difference between a hand tremor from Parkinson's and then other muscular issues that came with MS, and they viewed it as one and the same. And basically, this observation in muscular issues has been going on since the 1300s, where symptoms was observed, but the disease remained unknown to exactly what it was. And at first, the linkage was thought to be Parkinson's for quite some time, and then eventually it was determined that there's actually another muscular disease also which they discovered being multiple sclerosis. With further research, it also revealed to us that multiple sclerosis was a chronic disease, meaning once you get diagnosed with it, even up till now, there's still no cure for it. You have it for life, and basically, it affects the central nervous system and results in overall muscle degeneration and weakness. Basically, over time in the traditional human, if someone gets diagnosed with MS, they basically over time slowly weaken in terms of like bodily function, and in terms of like traditional muscle growth is not there. And what happens is over time, besides the muscle failures that take place, there's also this you end up also having mental effects as well, in terms of being able to understand basic ideas and concepts begin to go away. Your brain doesn't work as normally as it should, and what happens is way down the line you end up developing these holes in your brain essentially, which cause you to start to not think straight. And it ends up, that's like kind of like the other aspect of MS that's not really talked about, is it's the neurological effects that also follow with it, which are important to understand as well, that kind of develop after the bodily and muscular issues kind of already come into play. And basically, another thing I kind of wanted to shed light on regarding multiple sclerosis is like roughly like some basic, like data values, numerical data about MS. It's estimated approximately that about 1 million people in the United States alone get diagnosed with MS. Overall, a very uncommon muscular disease, however, it does happen. And even though you can be diagnosed like at roughly any age with MS, it's seen that most diagnoses and the onsets of MS come between ages of 20 to 40, but traditionally it's been seen that it occurs more towards the 20s and it ends up developing and obviously becoming worse over time. Unfortunately, there's yet to be certain treatments overall that have showed consistent improvement in people's muscular growth when they get diagnosed with MS. And even though there have been some therapies that have had, shown like some bright side, it's all been it's not able to help over the long run for a greater group of people. Currently, steroids and other pills are used more as traditional remedies for temporary fixes, but the muscle degeneration and neurological damage continue throughout someone gets diagnosed throughout their lifetime. I also wanted to kind of talk about now the symptoms of MS and like kind of how you're able to tell before a doctor's official diagnosis of you. Obviously, we have the bodily pains, which are like the first thing. And I think examples of bodily pains kind of go along the lines of like fatigue, nausea, bladder issues, even like the ability to like have like sexual dysfunction, And I think the most prevalent one is like a loss in muscle mass, especially in the lower extremities, in your knees and overall in your legs. Being able to walk becomes difficult. Being able to, the basic bodily functions all become very difficult to progress through. Other bodily pains include like forced slouching because it's affecting your spinal column of course. And basically, those are like a lot of the big bodily pains that we've seen with symptoms of MS that make it, unique. We have also verbal impediments, which is kind of important, and like verbal issues that kind of come along with MS that we've seen. I've seen like when we were doing research on this project, and I think a lot of it comes with slurred speech, which is a big one, even though that could be common for a lot of things. It's also with, short memory, being able to forgetting easily. And these two concepts tie greatly, and like cognitive issues, these issues tie greatly to what I talked earlier with how over time you can develop these holes in your brain, and basically what was once a normal neurological pathway and normal neurological function for you is not traditionally there down the line with MS as we've seen. I think, and then another like kind of symptom that's important to also talk about is like visual impediments. And I think this is also an important thing to talk about because it shows how blurred vision can come into play. And it's important to know this because it shows that MS, even though we know it is a muscular degenerative disease that affects the neurological system, it shows how it has effects on all aspects of your body later down the line. Like it starts with you have the muscle degeneration, but then you also have your brain isn't working the same as it used to, and then now you're also having vision issues as well. So it affects all aspects of one's body. And I think that's important to know as well going forward with understanding how the functions of MS and how we've seen with other muscular diseases in this class, such as DMD, that basically these muscular diseases tend to have long-lasting effects and have collateral damage almost, so that it goes beyond just your muscle and it can affect all other aspects of your body as well. And of course, it's important to know that since MS is chronic, that this tends to worsen over time, traditionally, to the point where most, if not all, patients who get diagnosed early on in life tend to be wheelchair ridden when they get older, as well as not being able to think or act under the proper conscience, because part of it is the muscular disease, but also another aspect which is important to talk about is that you're so incredibly medicated that you're basically your body's functioning on certain pills and extreme pills and steroids, and basically your conscience is not clear, nor are you able to already properly think. And it shows that in play, down the line, not all, you're physically handicapped and you become mentally handicapped as well. And that shows how damaging this muscular disease can be. And I think another important thing for MS that I wanted to shed light on, and my group mates will continue to talk about it going forward as well in this presentation, for this narration. Basically, MS, there's something that's not really talked about as much in MS, but I feel like it's important to also shed light on, and it's the 4 stages of multiple sclerosis. And basically, it's important to understand this because it shows that there's these consequential or numerical stages that take place with MS. And basically it shows that before one the next can't happen until the first one takes place. And there's instances where people can experience all 4 stages. And there's also instances where people can only experience the first couple. It varies per person, but a lot of the time it's over time do you experience all the stages. But obviously every patient and every diagnosis is different. But this is the traditional 4 stage of multiple sclerosis that we've seen. The first one we've seen that is like the stage 1 of MS is clinically isolated syndrome. And basically, I'm not going to go into too much depth on these topics because my groupmates are going to also shed light on them as well. I just wanted to talk about how there's this like almost this like sequence that takes place in MS. It's not just you have MS and a story. There's actually a lot more specifics that per each stage that one could experience. Then you also have relapsing remitting MS. It's referred to as RRMS, but basically this is like now considered the second stage after clinically isolated syndrome. A third phase is known as secondary progressive MS, also known as SPMS. Basically now here's like the next phase that kind of can happen unless the relapsing remitting MS first takes place, but it's important to know that this is the third phase or stage in MS. And then the fourth stage, which is been rare in patients, but it has happened, is primary progressive MS, which is also known as PPMS. And basically this part is where traditionally we've seen that even though it's in a smaller group of MS patients, this is kind of the classic phase of where people lose functions such as in walking and they become loss of ambulatory is how I've remembered it. And basically your like classic motor function is completely gone. And even though it's seen in a small group of patients, it's traditionally that they've had MS for an extended period of time. The diagnosis was early on in life, and this is kind of the final stage. And again, these were the main concepts I wanted to just shed light on. Regarding the 4 stages of MS, I talked about summary of MS, how it was discovered, the symptoms that one might feel. But I think the biggest takeaways from here is understanding that this type of muscular disease can affect all aspects of one's body, and in terms of feeling bodily pains, visual pains, and also neurological impediments that are very important to understand about MS going forward. And I hope you guys enjoyed my segment of the narration of multiple sclerosis. This topic actually means a lot to me because it plays a major role in my life, and it can have a personal connection to it. Not directly me, but and I think it's important to shed light on this muscular disease going forward. And without further ado, I think my next group mates are going to talk about other aspects of our research regarding MS. And thank you very much.
I wanted to go in depth about the 4 stages of multiple sclerosis MS that a patient will go through. The clinically isolated syndrome would be the first onset stage for a patient with the MS disease. During the stage, the patient will encounter a relapse where the lymphocytes that are identified as immune cells are attacking the nerve cells of the central nervous system, such as the myelin sheath. The attacks occur one at a time, and it would eventually lead to inflammation and having the nerve cells to become damaged. This would result in a cascade event where the impulse of the nerves are interfered by the attack, which is shown by the image on the right. This stage lasted at least 24 hours, and the MS patients until they were able to start recovering from the attack. The patients experiencing this stage would have the symptoms of dizziness, paralysis, and muscle weakness. The patient would continue on to the second stage, known as the relapsing remitting MS, RRMS. This stage occurs when the nerve cells are still recovering from the first onset attack. As a result, this second stage has the immune system to re-emit its attack on the central nervous system during the partial recovery process. The relapse in this stage is increasingly affecting the myelin sheath and the nerve cells. For that, the MS patient will have more extreme symptoms involving the muscles and cognitive skills. After the onset of RMS, the patient will continue to the secondary progressive MS, where the neurodegeneration is itself performing its process instead of relying on the attacks from the lymphocytes. From that, there is no clear diagnosis of when this stage occurs. As a result, the patient's doctor can identify if the patient is at this stage by having checked the past history of the ongoing relapses. The primary progressive MS, the PPMS, is the next stage where only about 10% of the MS patients have reached this stage. During this stage, the MS patients will have the lymphocytes to continuously relapse, where it will constantly attack the nerve cells. As a result, there would be no repeated relapse or remissions. This will ultimately have the central nervous system to have the most severity. This continuation will lead the patient to potentially lose the ambulatory where they become disabled. Here's an overview of the four stages mentioned, in which it is the process that the MS patients will undergo. The MS can affect the nerve cells of the nervous system as a whole, where the nerve impulse will not arrive to the skeletal muscle for support and nourishment. This can relate to the coursework of PS121 because there is a presence of muscle deterioration as the disease progresses over time. The skeletal muscles have lost a key factor to maintain its healthy condition. As a result, the diagnosed patient's muscle will become non-functional, in which they will lose the ability to utilize and move the body. There are risk factors of multiple sclerosis, in which are heat, alcohol, excessive motion or overwork, and the deficiency of vitamin D. As we can see from the image, these factors induce the symptoms of the disease where the nerve cells will not be in optimal conditions. Here are the treatments that have been progressively used as the years have gone by. All of these treatments of drugs shown like natalizumab in 2015 and cladribine in 2019 have been FDA approved in order to treat the patient with MS. However, there's a limitation in which these approved treatments do not cure the disease, but only slow down the progress. An example would be that the treatment of cladribine has a function to help recover from relapse of the disease. As a result, this would mean that these drugs shown on the image had advanced to reduce the actions of lymphocytes in attacking the central nervous system.
Hi everybody, my name is Angelica and I'll be going ahead and picking up where Michelle left off. As she was describing, there have been multiple drugs that have been attempted to be used as a treatment for MS. But one of the complications about MS is the fact that it is a disease of progressive nature, meaning that one drug that may be effective in stage 1 might not be as effective in later stages for some patients. So a very great tool in being able to assess this is the use of clinical trials. One in particular was conducted in 2016 and was titled Multiple Sclerosis Treatment, a Treatable Disease. And here the researchers did a very great job of not only outlining current treatments for MS, but they also assessed them. And they broke them down into the following categories: acute relapse management, disease modifying treatments, and symptomatic treatments. As for acute relapse management, the priority of this treatment is to exclude and treat the possibility of any infections, even as little as a UTI, just because this does make patients more prone to developing further lesions. And if a neurologist does suspect that a patient has developed a new lesion or maybe one is worsening, they go ahead and ask them to perform an MRI, one in which is being performed here in the image to the left, just to be able, again, to track the development of any lesions that can cause a relapse. And depending on whether or not a new lesion has developed, corticosteroids can go ahead and be administered to help shorten the duration of a relapse. Moving on to DMTs, the ultimate aim of them is to integrate clinical and MRI parameters, which will be monitored by the patient's neurologist. More specifically, DMTs are used during stage 1 of MS. And fortunately, studies have actually found that DMTs are useful in slowing the progression of MS from one stage of severity to the following one. However, there is a lack of research on the long-term effects and responses to DMT in patients. Lastly, there are symptomatic treatments in which researchers produce individualized treatment plans based on a patient's symptoms. So here in the next slide, we see a chart of different symptoms of MS all the way to the left, such as fatigue, cognition or low mood, pain levels, and depending on which one a patient is experiencing, a different drug will be prescribed and administered to them. And in addition to that, all the way at the right of this chart, we can see different treatments and therapies that a patient can go ahead and engage in. So, for example, if a patient is experiencing fatigue, they will be administered the drug of amantadine, and a multidisciplinary input and therapy they can go ahead and pursue is occupational therapy and physiotherapy for fatigue management and assessment. Moving forward, here we have a second study that was performed in 2020 and was titled Multiple Sclerosis in Children, Current and Emerging. And here in this study, what researchers did is that they went ahead and assessed different risk factors that they saw in patients that possibly make individuals more prone to developing MS or for it to progress in a more severe and rapid nature. And what they went ahead and found is that some risk factors were low levels of vitamin D, which are associated with an increased risk for MS, as well as exposure to secondhand smoke and exposure to pesticides, which once again also increase the risk of developing MS. And what this went ahead and showed is that there is a need for clinical trials for emerging MS treatment in children, just because of the fact that even these risk factors, the mechanisms of these risk factors are not fully understood, because although exposure to secondhand smoke and exposure to pesticides is a risk factor, it's not necessarily understood why this is so. And this same clinical trial also mentioned that it has also been found that children experience a more aggressive radiological course of multiple sclerosis in comparison to adults. And what that go ahead and means is the fact that children who do experience MS tend to have a more severe and progressive form of MS as opposed to adults who develop it in later stages of their life. Specifically, higher lesion numbers or volumes in children with MS were found in compared to adults. Also, children had a greater number of lesions, and in the same study, follow-up MRIs in children with MS were more likely to demonstrate the development of new lesions and lesions that went ahead and worsened, suggesting once again a more aggressive radiological course of MS in children. And here what we can see is an MRI that was performed on a patient, and all of these white dots are going to go ahead and be different lesions present in the child's brain. So here you can kind of see that the panel all the way at the top, all the way on the left, this patient these images are all from the same patient, but this first square goes ahead and shows probably the beginning nature of MS development. And in the second one, we can see a few more lesions, one here, here, here. And again, the lesions seem to be getting bigger and simply just worsening in this child. So again, this just reinforces the finding that children experience a more aggressive radiological course of MS. All in all, my team and I would like to conclude by providing some future directions for future researchers and physicians, neurologists, or anybody else involved with MS to consider. So given all of the points that we've gone over, the first suggestion is that clinical trials must be conducted in order to examine the mechanisms of MS development, specifically in children, mostly due to the fact that MS progresses more aggressively and rapidly in children. So being able to understand the mechanisms that lead to this would be a very great point for developments in terms of coming up with treatments and ultimately a cure for children and anybody suffering with MS. And as for a second point that we would like to make is that clinical trials must also examine the efficacy and drawbacks of current MS treatment. And this is just due to the fact that little to no research has been done in this field, and not much is known about the long-term effects of current treatments that are available. And this can be done by conducting a study which follows subjects from the first point in which they start taking treatment up until possibly they're in the most severe stage of MS. This type of study can be conducted in many type of ways, but the main point and main framework of the study that has to be carried out is a longitudinal study in order to be able to keep track of these drawbacks and long-term efficacy. And by doing so, these things will allow different patients to see which treatment works best for them in what stages of their disease. And this will allow them to make different choices, such as, do I want to take this specific drug for stage 1 or this drug for stage 2, just because there might be different drawbacks, for instance, maybe hair loss or leading to respiratory issues and other issues of the sort. And patients can decide to choose which drug they would like to make based on those different drawbacks and choose what is best for them ultimately. And here in these last 2 slides, my team and I just provided some sources that we use throughout this presentation. And thank you all for listening.